I was on active duty in Sarajevo, Bosnia, and Bosnia is a lot colder than around here. So one day while I was doing PT, I was running, hit an ice patch, and kind of fell back on my lower back and right hip. And when that happened, it was a sharp pain, and the sharp pain, turned from sharp pain into like a dull ache. But it, unlike before when I injured my back or injured my leg, it would get better. It might hurt for a week or so and then get better, but this time when I hurt my back, it didn't get any better. I had gained like 80 pounds in the last 15 years. I pretty much was homebound. I didn't get out and doing much because every time I, stood up, I had pain. My wife ended up saying, she did some research online and saw that USA Hospital had a complex spine center. PA Marcelo, he saw me, and I explained to him the whole thing. I just got through explaining that, if you cut this one little inch out, it'd be better. And he said, well, a lot of times spine problems, you can't really identify. It's hard to, figure out what's causing them.
I was taken back by the number of doctors he had seen, and he, had back pain. It's just, that's all, I deal with most of the day. He's a fellow Army brother, which was kind of cool. I'm also in the reserves. And so he gave me his story, and to be honest with you, I was a little discouraged at first because this is a guy that had over 30 procedures. He went as far as to get a spinal cord stimulator. That is an end game pain management tool. This is a guy who explicitly did not want pain medication. He just wanted somebody to fix his problem. The x-rays had an interesting finding. I see it almost every single day. It's called kissing spinous or base trips disease. It's not really a disease. It's just basically when a person is standing up and their spinous processes are really mashing on each other. But based on that, it went into the back of my mind. I got the CT myelogram. He's got no herniated disc, no pinched nerves, but he had a very specific complaint that his pain was in 1 square inch of a little area, very unique. I pulled Dr. Menger aside and I said, this is a unique presentation. I really want you to take a close look. And I didn't know how to test for his specific condition but Dr. Menger formulated a way to specifically isolate that spot, numb it up, and make sure that was causing his problem. And again, with no guarantee, but with lots of confidence, he went ahead and removed his spinuses.
They went in, did the 20-minute surgery, and walked out of the hospital, even walked out of the hospital after a 20-minute surgery. And within a day, that pain I had for 16 years completely disappeared. It was like a miracle.
We gave this guy back his life, his quality of life, and it's one of my favorite stories.